right, so assuming we will just move forward with the question and answer period? Yep, okay. We're back, okay, good. So we have a few questions from the public, folks that are watching. So I'll just start off with the first one. So for Mitsuru, there are a number of military bases in the Southwest. Do you know of any effort on the part of Department of Defense or VA to follow military personnel who have served at these bases through their military and post-military careers or possible COXI? Are there any collaborative studies or communication between DoD and CDC to track these data?
Thanks for that question. Currently, we don't have communication or partnerships with DoD on that matter. We know that some academic experts are following some of these military personnel on the academic basis, and there's been studies published there, but currently we don't have collaboration on that.
Thank you. For Gail, it seems that construction projects that bring in massive amounts of soil, fill, could be transporting risk of valley fever to both the construction workers and residents in locations proximal to those construction sites. Does the state of California have regulations on sourcing such soil for fill? Soil from the San Joaquin Valley being transported to the Bay Area, for example.
Yeah, thank you for your question. I honestly don't know if we have regulations on that. What I do know is that working with a lot of our construction site outbreaks, we've learned that a lot of the regulations...
Recording in progress.
within California are countywide. So for example, I know that in our outbreaks, any policies about protection of workers on construction sites or ways to keep dust down during a construction project to prevent fugitive dust from getting in the community, those are typically policies that are made in local planning departments at a county level. So for example, I know that our San Luis Obispo County has worked very hard with their local planning department to come up with really specific policies about worker education and keeping fugitive dust down, specifically for valley fever. But I think that was a very local effort. And I don't know if that included anything about fill, but I will certainly look into it. And I will say that one great policy that did happen, I think it was AB 203. We had a bill that was passed recently that makes it so that any construction workers who are doing construction in highly endemic areas, which have a rate of 20 or above, do have to be educated about valley fever. And that is a state bill that was passed.
Yeah, that's really encouraging to hear that. So for someone who does a lot of soil sampling, there are a lot of regulations at the federal level. So between states, there are a lot of regulations for good reasons on the transport of soil. And so you have to, obtain specific permits to do that kind of transport. But within states, it is not regulated. And so that I think is an interesting aspect, and maybe something at a county level that might be at least in an awareness, I think would be an important discussion. So this is a question from San Luis Obispo Public Health. We have heard from community members that the cost of testing is a barrier, especially for the uninsured population. So I think this is maybe a broad question to anyone who has information, but are there resources for uninsured patients to get tested?
Yeah, thank you for that. I will say we, as I mentioned, launched that patient interview project recently, and that's a question that we've gotten from a lot of the patients that we've interviewed, is not only diagnostic, like support getting testing, but also for treatment. And as far as I know, I don't know of any state programs that are supporting that right now, and I would love to hear if any of the clinicians in the crowd who work with the public more one-on-one know of any programs that they've recommended people to, because at the state level, at least, I was not able to find something for those folks.
Yes, I see. Anyone have any other information? Again, maybe something to focus on in terms of outreach and support. So Royce?
In Kern County. We don't have great troubles with seeing people find care in our area. I mean, I won't say there aren't problems, but the percentage of people that complain about that is very small. So I don't think it's a huge problem, but there are insurance issues more around treatment than around diagnosis. And so people show up in emergency rooms, always get tested. And I think the same is true for urgent cares, assuming someone thinks to order the test. And there's certainly issues with the tests, as has been mentioned. But I think we have more troubles around treatment than we do about diagnosis.
I will just add to this conversation that we recently, I should have had a slide on it, did an analysis to look at health disparities in valley fever in California. And there's this indicator that puts together several different measures of a sort of being disadvantaged in different ways: socioeconomic status, education level, access to care and things. And we did find that people with valley fever tended to be people who were in the lowest groups, the people who were most disadvantaged, who had the lowest SES and all of those things. So I think that anything we can do to support people in California and elsewhere, it does seem like it's impacting the groups who are probably struggling the most.
All right, any other comments from clinicians or other folks who want to chime in the audience? Dr. Galgiani, okay.
John Galgiani from Arizona. Shane, in that regard, my recollection from the enhanced surveillance from 2007 was one of the findings was that actually the diagnosis of cocci was an equal opportunity disease, and that it cut across all strata of insurance or reimbursement strategies. Do you recall if that's true? That was my recollection. Ms. Zura, do you remember that? Clarice isn't with us, so that's the person who would answer that question. But that was my recollection, was that we see a diagnosed but I mean, that's different from what happens on a daily basis, whether you get tested or not. But in general, of those that ended up getting diagnosed, it didn't undercount people without health care.
Yeah, I think that's correct, Dr. Galgiani. I think in our more recent enhanced surveillance, there might have been some differences, though, in terms of healthcare access and diagnosis. But I don't have those numbers in front of me.
Okay, great discussion. Thanks, everybody. So this is more of a comment and maybe can spur a little bit of discussion. So in San Diego, we observe more cases after each fire season, but often delays in presentation by several months. The Santa Ana winds blew west from sparsely populated areas. It looks like infections occur in western areas, but in reality come from the eastern county. In San Diego County is the size of Rhode Island, so even county-wide data is not granular enough. And this is particularly problematic in Arizona, where we have these giant counties. And so I think, there are potential issues with granularity, and then fire, I think, is a whole other discussion. But anyone want to comment or?
Well, I can add that the connection between wildfire and coccidioides incidents at the population level is something that UC Berkeley and CDPH have been working on together, and we have a paper under clearance right now with CDPH, so I don't know how much I can share on that, actually. But yeah, I'll just say stay tuned. And it seems to maybe depend on, the specific fire, whether or not we see an association. But regarding the granularity of data, I do think that has been a challenge in a lot of the investigations between climate and other climate-related factors and cocci. And I think in part that's why this partnership with CDPH has been great, because we are able to look at census tract level data. Our group hasn't necessarily focused on San Diego because it doesn't have as high of rates as other counties. So it would be interesting to dive more deeply there. But I do think that the association with wildfires could also just be that wildfires tend to happen when it's hot and dry and dusty, and coccidioides also tends to spread when it's hot and dry and dusty. And so observing that sort of wildfire happened and then people got sick could also just be coincidental and compounded by other environmental characteristics.
Yeah, and I'll just add, we have something in clearance, so we can't say much, but we have looked at that. We've looked at wildfires with the surveillance data in California, so again, stay tuned. I will just mention, though, that we have had a number of outbreaks in wildland firefighters, which I think sometimes people think that means that the fire is related. Mostly what we found in those outbreaks, when we talk to the people who are infected and part of the outbreak, is that they are workers who are very much involved in dirt disturbance. They're building a fire break around the fire, or they're doing this thing called mopping up, where they're kind of putting out fire in the dirt. So it's a very dirt disturbing profession. So what we have kind of brought from that is that we think that really is the big risk and not the fire, which is not to say that there couldn't be a role for wildfire and cocci risk potentially, but that's the main thing going on the outbreaks, we think.
So, I mean, it is interesting to think about the stochastic nature and you know, some of the data from the air, the more, the weekly air sampling, right? And that we see that certain spots had a high signal and then it just disappeared, right? So I think there's also a piece of that is going to be, you know, we need further investigation in that area too. Did you want to comment on that?
Yeah, and a couple of things. And you guys missed like the best slides, so sorry. Actually tried to pull it all together, but the point with you know, that stochasticity, I think it is because we heard the phrase nonlinear complexity, and this is absolutely true. There's a lot of variables that are involved, and some are involved sometimes, and some are involved at other times, and sometimes they're all involved. And one of the major problems that we have is, you know, we still don't have a really good map out where we see higher prevalence in the soil. So now we're starting to see where we see higher prevalence potentially in these air filters in a location across, you know, like the Phoenix Valley region. But even if we do have that mapped out, we don't know when we're getting soil disturbances. Mm-hmm. And so I absolutely think that, you know, cutting fire line and those kind of things, you're getting exposed to it. I do think the, you know, construction around the valley changes locations, and that might be part of what's driving. Sometimes that's new housing, but a lot of times they're putting in either new freeways, they're cutting up dirt for, you know, the rail line that they're putting in, a variety of things that we've seen have been associated with outbreaks in California. I do think is probably driving some of those differences. It's going to be very hard to model.
One last question, I think from, oh, sorry, GR?
GR Thompson from UC Davis. I've been really interested in this question of fires for coccidioides, but also fungal pathogens and even gram-negative bacteria. And we've done some work with the National Fire Center, and monitoring drones that are flown over wildfires is actually very difficult to do. You're not allowed to fly drones over naturally occurring wildfires, which makes that quite a bit more difficult. So a lot of the data is from controlled burns, right, or prescribed burns, rather than naturally occurring ones. And we've seen Aspergillus, Mucorales, Cryptococcus, and Dave, I was actually a little interested in your thoughts on crypto moving from Australia to the Northwest. You know, when that Australian wildfire occurred, you know, we saw in the news the satellite footage, right? The plumes went across the Pacific. But I'm sort of having a difficult time contextualizing. Do you think it spread that way, or do you think it's just sort of there and appears? But it's very clear from the drones that we're finding all of these organisms in smoke. But I'm not sure if it's spread there, particularly after listening to your talk.
Yeah, so I mean, there's no doubt if cocci gets up in the air, it can spread by wind. But it's not clear that, just going back to the dust storm issue, that dust storms are actually pulling cocci up into the air. That great example of the tempest from Tehachapi, you read the account, it takes off something like the top, you know, 12 centimeters of soil as it's pulling across. That's getting down into the soil where cocci is. You know, the studies that we were seeing, that you're much less likely to find cocci just on top of the soil. I think that's absolutely true. And so I do think it's whatever it is, it's got to get it up out of the soil. And I do think that soil disturbance, I think there's so much soil disturbance during natural disasters, fires included, that it allows for that cocci to now become exposed and then get up in the air and sometimes carried long distances. But cocci specifically, I don't think drops out and then starts the grow and blow doesn't necessarily go to grow again, right? It can get into the air, you can breathe it in. The only way that affects dispersal is if you get enough mammals breathing that in after it's blown into maybe a new area, and then they die and get down into the soil, and now you've got a bolus of cocci there, and then I think it can survive, and that allows for dispersal. That probably doesn't answer your question, though, GR.
All right, so we're going to be going to the audience. So, Josh.
So one thing that does move with fires are animals, and animals can move many, many miles. And if there are the ones that are infected and maintaining it, when they shift a few miles north and a few miles north, they may be the ones moving things. I have a question for Morgan and Jen and Dave too with your models. If you look at Latin America, some of the territories where you see Posadacea are very different than in New Mexico and in the San Joaquin. And have you modeled the data down there, and do your models still work in the other parts of the very important area where cocci exists?
Yeah, thanks for that question. Cocci is not a problem limited to the United States. What's very difficult in studying it in other areas is limited case data and access to case data, and disease surveillance systems outside the United States are oftentimes just not as robust as the U.S. So we have applied our endemicity model to North and South America, and a map was just submitted to a Journal of Fungi that Bridget Barker's overseeing. So stay tuned.
Stay tuned.
But it's really a preliminary map, and I hope it encourages folks to kind of start disease surveillance in those areas and maybe soil sampling, and maybe we can tease out some other information about the fungi. Thanks.
Mark and then Anna.
Mark Orbach, University of Arizona. Dave, I was wondering, it's sort of surprising to me, but there are intensive agriculture areas around the Phoenix metropolitan area, and I was wondering whether the differences in positivity rate might be due to those, at your different sites, might be due to those agricultural areas, or them coming in and going out of use over the time period, or any other land use changes over your study.
Yeah, thanks, Mark. That's actually really a good observation, is that, I think the more important word there besides agriculture is the phrase land use changes, it's the changing of the landscape. And so when you look around the periphery of the valley, as the valley has continued to sprawl, some of that, especially going north, is overtaking virgin desert. Some of it is overtaking really old, agricultural use areas for over the past 50 to 100 years. And so that's another data layer that we're just starting to map, is trying to understand not only what are the land, what's the land data now, but how has that changed over the last 20 years. And there's some really interesting things there too that we'll be pulling into future. You'll see some in future analysis, but it's a really good point.
Anna.
Hi, Anna Litvintseva, CDC. I have a question for Jennifer. Jennifer, wonderful talk, and I'm honestly very, very intrigued by the last part of the correlation with animals. I do have a question, and I'll hold on to my mic because depending on the answer, I may ask a follow-up. So you were comparing soil from rodent burrows with the surface, and can you maybe elaborate a little what that surface samples are? And do you think it's an informative comparison, or maybe there are some variations?
Yeah, thank you for that question. So our sampling design is factorial. So we're sampling from within precincts. So the precincts are like mounds, and we take 5 of the borough entrances and sample. And then we sample 5 surface samples going outward from one of the borough entrances. And we dug a hole 10 centimeters deep and scooped across the gradient there to collect across that top surface. And we did that for both the rodent exclosures and the non-rodent exclosures.
Okay, perfect. So it's not surface, because when people say surface, it's not, yeah, okay, no, I'm glad you're doing that.
Right,
Surface.
yeah,
Okay,
yeah.
excellent, thank you.
Okay, and then I think Manesh.
Hi. So many of you guys have modeled the change in cases with regard to climate and weather, and that's wonderful. Some of the cases, of course, become disseminated and more severe, and we have this genetic immunological hypothesis as to why they get severe disease. But I'm wondering, and we always deal with this in immunology, is severity related to inoculum? The amount of exposure could be simply driving the severity rather than the genetic immunological hypothesis. You know, we like our hypotheses, but I wonder, can you elaborate a little bit on the idea that there could be more inoculum, not just driving cases, but driving severity? Do any of your data shed light on that? This is for I guess, both the Arizona and the California groups.
Yeah, I can say work from our group at Berkeley is investigating that using a causal mediation approach to examine the association between dust and incidence, and then also asking are certain populations exposed to higher dust. And so I guess I can't say too much about the results of the analysis, but I think it is something that I will say, like, yes, I think that there is reason to suspect that certain racial groups might be experiencing higher rates of dust and other environmental pollutants.
And I can just add that from our outbreaks that we investigate, based on what we've heard about the percentage of people that tend to get dissemination and things, when we see our outbreak cases, and I've talked to a lot of these cases, they're very sick. And I think we've always had this hypothesis that it's because they're getting this giant inoculum of cocci when they're actually in the ground doing the digging. So I think we have kind of suspected that just based on what we see among our outbreak cases, who tend to be very strong, young, healthy men doing construction is typically who we see. So we've long expected that. And then for the work that we do with Jennifer's team, unfortunately right now we just have case data. We don't have data on severity because we're not interviewing our patients. So hopefully if we are able to continue this enhanced surveillance project, we would be able to maybe even do some modeling with people who are hospitalized, people who had dissemination, but our data just isn't there right now. We just know it's a case, and that's all we've got.
Yep. Katie?
Thanks again. That was a fantastic panel. Katie Walter from University of Utah. I'm wondering about the distribution of cocci. So perhaps for Jennifer or Morgan, I'm wondering if the Rocky Mountains pose an ultimate limit on range, or if it's just a temporary constraint, and if we should potentially be monitoring soil and air elsewhere in the eastern U.S.
So particles can get really high up into the atmosphere and spread really far. And we see that with smoke or volcanic emissions when they spread globally. So I don't think that the Rocky Mountains are necessarily limiting the spread of anything if it gets very high up into the atmosphere. But very high up into the atmosphere are very different conditions than down at the soil surface. And I think we don't have a good understanding of what cocci can survive in terms of exposure to UV or exposure to temperature extremes. So it could be spreading and dying. Maybe it's spreading and living. I don't think the Rockies pose a great barrier if stuff gets high enough in the atmosphere.
Yeah, to be determined, right?
Yeah.
We did have a couple people ask sort of the same question related to, from online, related to the difference that we see in California and Arizona related to the disease being more common in males versus females, and why do we think that might be? Any ideas about mechanism?
Yeah,
a lot of people want to answer this question. So I know Shane, you had brought this up. So like maybe Matsuro, Gail, and then Shane can pipe in.
So interestingly, we actually see similar trends in all fungal diseases, and we actually don't know what it is. From surveillance data, we do see the same trend. Right now, we say that perhaps occupational differences or, exposure to outdoors may be, the risk factor and differences that we see. But certainly, we hypothesize that there might be something going on with underlying genetic factors. And I think that would be areas that we would like to encourage other researchers to really look into more deeply.
And I can just add, in California, we did look at this by age, and I wish I had my figure, but we mapped, or we did a graph that is published where we look at incidence rates by age, and we have males and females. And it's interesting because if you look at them before the age of 12, males and females seem to have about the same rate, and then it splits. And then males get much higher based on California data over several years. So, I mean, that age obviously begs the question of potentially hormonal influences, but also what Mitsuru said, there's also the fact that men might be more likely to be doing disturbing activities and things as well. So I think it's multifactorial. And then for Shane, I don't know why you guys are seeing the opposite in your data.
Yeah, for Arizona, I think we don't understand it, actually, why we're seeing the switch. Like I said, for hospitalizations, we do see more males hospitalized. But when it comes to ED visits, it's kind of more split, with some years where it's more preponderance of females. So it's hard to say whether it's care-seeking practices and testing practices that may be playing a role for some of it. And like you said, I think it is multifactorial for some of the other variables you mentioned.
Okay. Yeah.
Thanks very much. I'm George Rutherford from the University of California, San Francisco. I'm going to go back 15 to 30,000 years and talk about paleoanthropology, about which I know nothing. But in one of the old dicta of Coxey was that when the American Indian, Amerindian population migrated south from the Bering Strait, everybody who went south of the Coxey zone in the U.S. and Mexico made it to the other side, right? And so was there natural selection going on for people who did better to get through the other side? Now, understanding race is a completely artificial construct, but setting that aside, one of the things was that we're always interested is given equal exposure, were people whom we call Hispanic now, who came from Mexico, right, who had gone through the zone 15,000 years ago, were they less susceptible than others given equal kind of exposure? And the only place you could ever answer that would be among people who were brought in from the outside, right? So Fort Irwin or the Marine Corps station at 29 Palms, including people who grew up in the endemic areas. Could you look at that and see whether there really was a racial and ethnic predilection? The original stuff, I don't know if people know this, came from Mintier Field in Bakersfield in World War II, where it said that Filipinos and African Americans had higher rates, but they were the ones who were digging the ditches. So it was a little, that's a little bogus. But I think this is kind of an interesting question, one of these paleoarchaeologic questions. I guess paleoarchaeology is redundant. But paleoanthropologic questions about, is there some sort of, has there been some sort of selective advantage conferred to people of American Indian ancestry who made it through this zone to go to Mexico and point south? So I'll turn that over to you guys.
I can say for California, looking at data on Latinos has always kind of confused us because some years it looks like they have higher rates, some years it doesn't. They may seem like they have higher rates in the case data, but not in the hospital data. And then when we did that regional analysis, we found, in contrast, that Black populations, no matter what region of California you were in, had higher rates than white populations in comparison. For Latinos, it was different. It depended on the region. In some regions, they had higher risk, and in some they didn't. And what is that? I mean, it's really hard to answer. Could it be the activities they're doing in those areas or something else? So I will say I don't totally understand, but they're a group that I think in California, we're always uncertain about our messaging. And now that we're doing the Enhanced Surveillance Project, I wish we had a question on immigration. And maybe since we're only halfway through, we can add something in there. So no answers for you, but we've been very confused by kind of the different things we see in that population in California.
Additional questions? Oh, is it George?
G.R. Thompson, UC Davis. I was just going to follow up on the sex differences for coccidiomycosis, because that's always really troubled me sort of intellectually. And the only paper we found that really showed a big risk for a female predominance of cases was one of the older papers, and they had a high incidence of erythema nodosum, and they thought that's why they'd come to clinical attention. So that may have been a bias in that group. And I mean, most of the other papers, and Gail, we've certainly quoted yours in that recent work, was, this male predominance of infections. And then, Bridget and Jane Sykes also gave us veterinary data to try to see, is this sociologic or biologic? And when we looked at that, there was a primate colony, right? And so they were on a concrete slab, so digging behavior between males and females, primates is maybe moot, right, if they're on a concrete slab. And in that circumstance, the males had more cocci than the females. And then in the veterinary population, when Jane pulled all of their data, male canines were at greater risk than females, and if they were neutered, they returned to the same risk as females as well. So we do think it's probably biologic from that, but I think certainly an area that needs a lot more attention.
You defer to Royce? Okay, fair.
With your permission. So this is not unique to cocci. Males have higher rates and higher death rates from almost all infectious diseases. And I tell that to my students, and I tell them, the female students usually smile, and I point out, you have more autoimmune disease. So it's males and females, despite this being somewhat politically incorrect, really are different.
Further questions from the audience? There's. Can I ask my question? Okay, go. Okay.
So Rob Purdy, I'm a patient from Bakersfield. I also work at the Valley Fever Institute. I have kind of a more global question, which is why I saved it for the end, but it is kind of really more directed at Mitsuru and the CDC. So a 10,000-foot observation of the entire panel, who's doing great work, is it's very compartmentalized in the sense that while there's great work being done in the states, it doesn't necessarily cross state lines a lot. So for example, the way that the state of California reports their cocci data versus Arizona tends to be more driven by the specific, and in this report, in these PowerPoints, driven at the county level, whereas Gail's report looked more at regional. Do you think there's a good opportunity and hopefully a likelihood of success that the projects that you're talking about releasing in 2023 can begin to address some of that issue?
Yes, that's certainly our hope, and the reason why we want to launch these partnerships and projects that I've talked about. I think surveillance has always been difficult, and we say that it takes a village to do surveillance. Each state, each local health department, they all really need to work together to collect data and to not just collect it, but to make it standardized and then systematically report to CDC, which is a whole big hassle. And so, yeah, I really am hopeful that we can start dialogues, continue partnerships, and then also learn from fantastic partners like Arizona and California that have done excellent work on surveillance.
Yeah, me and Rebecca Sonnenschein from Arizona at one time had a discussion at a cocci study group about how even though we've got two different species of cocci, we've got Possidacea in Arizona and Imidis in California, we've never really done a joint study to look at if they present differently, which why have we not done that yet? And I think, the government is so good with our silos, but I think we are really trying to break them down. And I think we are collaborating a lot more with Arizona and with CDC and other folks than we used to, and would love to have a chance to really compare that data and see if we really are finding differences, because we haven't done it.
And on that note, which is a very favorite note of mine, and I will continue some of that discussion in my talk later this afternoon, I think it's time for lunch and a break, and we can continue our conversations over food.